Hey everybody, it's Santosh, and welcome back to my channel. Today, we're diving deep into the world of one of the most loyal, intelligent, and energetic breeds I know, the Belgian Malinois. These dogs are incredible companions and formidable working partners, but like all breeds, they come with their own set of potential health concerns. Now, I believe that knowledge is power, especially when it comes to our furry family members. By understanding the health challenges that Belgian Malinois may face, we can provide them with the best possible care throughout their lives. We're talking early detection, proactive vet visits, and a healthy dose of love and attention. So whether you're already a proud Malinois parent or you're considering welcoming one of these magnificent dogs into your pack, stick around. We're about to equip you with the knowledge you need to keep your Malinois happy, healthy, and thriving for years to come. Let's jump in. Okay, let's talk about hip dysplasia, a common problem in larger breeds like our Malinois friends. You see, it's all about the hip joint. In a healthy hip, the ball and socket fit together nice and snug. But with hip dysplasia, the joint doesn't develop quite right, causing pain and stiffness. Now, genetics play a big role here, folks. If the parents have hip dysplasia, the puppies are more likely to inherit it. But don't worry, there are signs you can watch out for. Is your Malinois having trouble getting up? Are they hesitant to jump or climb stairs? These could be signs of hip pain. You might even notice them limping or favoring one leg. And listen, I know your Malinois is tough, but don't ignore these signs. Catching it early is key. Your vet can diagnose hip dysplasia with an X-ray and recommend the best course of action. Remember, early intervention is crucial for managing hip dysplasia and ensuring your Malinois enjoys a happy, active life. Let's talk about another concern. Progressive retinal atrophy, or PRA. This one affects the eyes, specifically the retina, which is like the film in a camera that captures light. In dogs with PRA, the retina deteriorates over time, leading to vision loss. Now, PRA is often inherited, so genetics are a big factor. Early signs can be subtle. You might notice your Malinois having trouble seeing in low light or at night. They might bump into things or seem disoriented in unfamiliar environments. As the disease progresses, their vision will continue to deteriorate, eventually leading to blindness. It's heartbreaking, I know. But here's the thing. While there's no cure for PRA, there are things we can do. Early detection is key. Regular eye exams by a veterinary ophthalmologist are crucial, especially if you know PRA is prevalent in your dog's lineage. And remember, even if your Malinois does develop PRA, they can still live full and happy lives with the right care and support. Chapter 3. Epilepsy. When the brain short-circuits. Epilepsy. It's a scary word, I know, but understanding it is the first step to managing it. Epilepsy is a neurological disorder that causes seizures, which are basically electrical storms in the brain. Now, seizures can manifest in different ways. Some dogs might have focal seizures, where only one part of their body is affected, like a twitching leg or face. Others might experience generalized seizures, which affect the whole body and can cause collapse, convulsions, and even loss of consciousness. Genetics can play a role in epilepsy, but it can also be caused by other factors like head injuries, infections, or even tumors. If you witness your Malinois having a seizure, it's crucial to stay calm. Don't try to restrain them or put anything in their mouth. Just make sure they're in a safe space where they can't injure themselves. The good news is, epilepsy can often be managed with medication. Your vet will work with you to find the right dosage and type of medication to control your dog's seizures. Chapter 4. Elbow dysplasia, more than just a limp. Let's talk about elbow dysplasia, another joint issue that can affect our Malinois companions. Like hip dysplasia, it involves abnormal joint development, but this time, it's the elbow joint. Elbow dysplasia can cause pain, stiffness, and lameness, making it difficult for your Malinois to enjoy walks, playtime, or even simple movements. You might notice your Malinois limping, holding their affected leg up, or showing reluctance to put weight on it. They might also lick or chew at the elbow area to try and alleviate the discomfort. Genetics are a major factor in elbow dysplasia, but environmental factors like rapid growth and high-impact activities can also contribute. If you suspect elbow dysplasia, don't wait. Early diagnosis and treatment are crucial for managing the condition and improving your dog's quality of life. Chapter 5. Gastric Dilatation Volvulus, GDV, a race against time. Okay folks, this next one is serious. Gastric dilatation volvulus, or GDV. This is a life-threatening condition that can affect any dog, but deep-chested breeds like the Belgian Malinois are at higher risk. Here's what happens. The stomach fills with gas and then twists on itself, cutting off blood flow. It's extremely painful and can be fatal if not treated immediately. Symptoms of GDV include a visibly swollen abdomen, restlessness, pacing, excessive drooling, unsuccessful attempts to vomit, and signs of shock. If you see these signs in your Malinois, don't hesitate. This is an emergency, and you need to get them to a veterinarian immediately. While we can't always prevent GDV, there are things we can do to reduce the risk. Feeding multiple small meals a day instead of one large one, avoiding strenuous exercise after meals, and ensuring your Malinois doesn't eat too quickly can all help. Outro: a healthy Malinois is a happy Malinois. So, there you have it, folks. We've covered some of the most common health issues that can affect Belgian Malinois. Remember, early detection is key. Regular vet checkups, paying attention to your dog's behavior, and knowing the signs and symptoms of these conditions can make all the difference. If you notice anything unusual or concerning, don't hesitate to contact your veterinarian. They are your best resource for keeping your Malinois happy and healthy. Thanks for joining me today, and don't forget to subscribe for more tips on keeping your furry friends in tip-top shape. Until next time, take care of yourselves and your incredible dogs.